Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for rhinitis in pregnancy. Tip number 1, let's first know what rhinitis in pregnancy is. Rhinitis just means you have a stuffy nose or a runny nose, and this topic applies to women who are pregnant who notice that they have a stuffy or runny nose. There are three main causes of rhinitis or stuffy nose in pregnancy. The first main cause is called pregnancy rhinitis. It happens in 30% of normal pregnancies, and usually there's just nasal congestion by itself. And usually it resolves 2 weeks after you deliver. So the one type of runny nose or stuffy nose in pregnancy is called pregnancy rhinitis. Another main type of rhinitis in pregnancy is called allergic rhinitis. Usually women with allergic rhinitis already had this condition before they became pregnant, but occasionally women notice their allergic rhinitis for the first time in pregnancy. This is due to allergies, and often, in addition to nasal congestion or runny nose, women will have itchy nose, sneezing, itching, and irritated eyes. So the first two main causes of rhinitis in pregnancy are pregnancy rhinitis and allergic rhinitis. The third major cause is bacterial sinusitis. This is an infection with bacteria, and you'll notice in addition to the runny nose, tenderness or pressure over your sinuses. Here are your maxillary sinuses, here are your frontal sinuses. You'll have pain and tenderness in these areas if you have possibly if you have bacterial sinusitis. Women also tend to have a fever. This is the one condition of the three I've mentioned where you must see a doctor immediately. If you're pregnant and you have sinus pressure in addition to a fever, you absolutely should see your doctor immediately. So the tip number 1 was the three main causes of rhinitis: pregnancy rhinitis, allergic rhinitis, and bacterial sinusitis. Tip number 2, and the remaining tips, are ways to prevent and treat rhinitis in pregnancy. Tip number 2 is don't smoke. There are many reasons not to smoke for the health of yourself and for the health of your baby. You should avoid smoking and avoid exposure to secondhand smoke during your pregnancy. Smoking will make allergic rhinitis worse as well as pregnancy rhinitis. And it will lead to an increased risk of bacterial sinusitis. So for many reasons, in addition to reducing your risk of rhinitis, do not smoke or expose yourself to smoke during pregnancy. Tip number 3, regular exercise. Regular exercise is recommended for all adults, including pregnant women. It's recommended that you exercise for 30 minutes, preferably every day of the week. And exercise can just mean walking at a brisk pace. When you are pregnant, it is important that you do not exercise to the point that you become out of breath. So the way to know you're exercising is not too intense is to see if you can carry on a conversation at the peak of your exercise. You should always be able to carry on a conversation during the peak of your exercise when you're pregnant. You should never get to the point where you have to take a breath to continue finishing a sentence. Tip number 4 is to eliminate dust and animal. Oh, by the way, the reason why exercise is effective, not only for your health, is it causes what's called a physiologic nasoconstriction, which is basically reduces the swelling of your nose if you have pregnancy rhinitis. Tip number 4, eliminate dust and animal dander. So this is a very helpful way of preventing and treating allergic rhinitis. Dust mites and animal dander are two main causes of allergic rhinitis. To eliminate dust dander, it's important to avoid living in a place where there's carpeting. Floors are much better because it's a lot easier to clean dust off floors. If you are not able to avoid living in an area with carpeting, so if you do have carpets, it's important to vacuum your carpets with a HEPA filter at least once a week. If you have floors, it's important to wash your floors once a week. You should also clean all surfaces in your house at least once a week, and you should wash in hot water and on a hot dryer setting all of your bedding every week. These are helpful tips for reducing dust in your house. Another tip is to use a HEPA filter, an air filter in your house that will remove many of the particles of dust. If you only can buy one air filter, the best place to have it is in your bedroom, where you spend most of your time in your house. And animal dander is another thing to reduce to reduce the risk of allergic rhinitis. So if you do have a pet, it is preferable that your pet stay outside. Tip number 5 is a neti pot. A neti pot is something you can buy in a drugstore, and it basically uses normal saline, which is just water with some salt in it. And it's a pot that you use to wash out your nasal passages. You should do this once a day or as often as needed. And it's helpful for both pregnancy rhinitis and allergic rhinitis. Tip number 6. Here are 2 other treatments for pregnancy rhinitis. You can elevate the head of your bed using blocks, bricks, or other objects underneath the legs of your bed to give your bed about a 30 to 45 degree angle so your head is higher than your feet. This will help with the congestion that occurs in pregnancy rhinitis. Another tip is to purchase over-the-counter adhesive strips, which are specifically designed to put on your nose and to dilate your nasal passages. These are 2 effective ways of reducing the swelling that occurs with pregnancy rhinitis. Tip number 7, nasal chrome. So nasal chrome is the brand name for cromolyn sodium nasal spray. This is something you can buy over the counter, and it's recommended because it's very safe in pregnancy for patients with mild symptoms of allergic rhinitis. It can be used in your nostrils as a spray up to 6 times each day. Tip number 8, Rhinocort Aqua. So Rhinocort Aqua is the brand name of budesonide intranasal spray, which is a steroid spray that's safe in pregnancy and is effective if you have allergic rhinitis and your symptoms are moderate or severe. So again, the cromolyn spray, which is over the counter, is useful if you have mild allergic rhinitis. The Rhinocort or budesonide spray is by prescription only. It's also safe in pregnancy, and it's recommended if your symptoms are moderate to severe. It's recommended as a 32 microgram spray in each nostril, 1 spray each day. Tip number 9 is an oral antihistamine. So an oral antihistamine is not as effective as an intranasal steroid, but it could be used and it might help some people. It's recommended for allergic rhinitis, and the 2 safest forms are loratadine 10 milligrams, the brand name is Claritin, or cetirizine 10 milligrams a day. The brand name of cetirizine is Zyrtec. And tip number 10 is to believe in yourself. I've presented 10 tips or 9 tips for identifying and treating rhinitis in pregnancy. They are knowing how to identify rhinitis, not smoking, engaging in regular exercise, eliminating dust and animal dander, using a neti pot for both allergic and pregnancy rhinitis, elevating the head of your bed or using specially designed tapes for pregnancy rhinitis, using cromolyn sodium spray for allergic rhinitis if it's mild, using budesonide intranasal spray for moderate to severe symptoms, and also considering an oral antihistamine such as Claritin or Zyrtec. I hope these tips have been helpful. Thank you very much for listening, and have a great day.